The Department of Health sees no need for the country to shut down its borders despite surging number of COVID-19 cases in China. In a press briefing, DOH officer in charge, Undersecretary Maria Rosario Vergeire, said that closing of the country's borders to China is not necessary despite its rising COVID-19 cases. Meanwhile,
hindi pa po tayo napapanahon o wala po tayong nakikitang pangangailangan para magsara tayo ng borders specific to this specific country o di kaya magkaroon ng mas maigting na restrictions para sa bansang ito. Nakita natin ng ibang bansa na pumutok ang kanilang mga kaso, no? Libo-libo, hundreds of thousands, pero hindi naman natin sila sinara ng border. Hindi natin sinabing, kayo, pag dumating kayo, meron kayo dapat na specific na restriction dahil marami kayong kaso.
First, the DOH doesn't think that it is required or it is needed already that we close our borders or have these regulations or restrictions specific to China only because of what's happening in their country. As I've said before, we are in a much better position currently, no, compared to 1 or 2 years ago, because most of our citizens are fully vaccinated already. Most of our citizens have learned that good behavior of practicing the minimum public health standards. Now, as for our regulations within our borders, we cannot just have our closure and then open it and then close it again, then open it. We are all moving forward because we would like to reach that new normal.
Meanwhile, countries like Japan and the United States will impose mandatory COVID-19 tests for passengers from China. The Department of Transportation, however, is recommending mandatory COVID-19 testing for passengers from China. Transportation Secretary Jaime Bautista on Wednesday floated the idea of requiring testing for travelers from China as a safety measure. Bautista said that they would also look at how other countries were responding to the situation, noting that other ASEAN countries are also cautious in accepting Chinese visitors.